Good afternoon, everyone, and welcome to the CAQH webinar on improving the delegated roster process with Blue Cross Blue Shield of Tennessee and Ballad Health. My name is Rebecca Beatty. I'm a product manager at CAQH, and I will be the moderator for today's webinar. Before we get started, I'd like to review some housekeeping details for all of you on the phone today. Today's session is being recorded, and by the end of the day tomorrow, you will receive a link via email to the on-demand webinar that you may share with others in your organization. The recorded webinar will also be posted tomorrow on our website. Your phones will be muted throughout the webinar today, so if you need to ask a question, you need to submit that online. You may ask your question at any time throughout the session. Simply type your question into the right side of the GoToWebinar panel. We will address your questions at the end of today's presentation. Now I would like to introduce our presenters today. They are Valerie Osborne, who's Manager of Credentialing at Blue Cross Blue Shield of Tennessee, Lorraine Dover, Director of Contracting and Provider Support Services at Ballad Health, Susan Whitfield, Database Analyst at Ballad Health, and Mike Woods, Manager of Provider Engagement at CAQH. I will now turn the presentation over to Mike.
Thank you, Rebecca. Welcome, everybody, again. I appreciate you all taking the time to join us today, and thanks for those of you who have gotten here early due to an earlier notification that was sent out. I really appreciate your patience. So here's our agenda, and I'll get started by presenting the challenges associated with delegated roster maintenance and sharing. I'll then give you an overview of our solution to these challenges, and then let Nellie, Lorraine, and Susan share their experience with our solution, CAQH ProView for Groups. As mentioned, if you have questions, please submit them via chat. CAQH initiatives. So on this slide, what's an important piece for you to know is CAQH, we'll be talking about CAQH ProView for Groups today. Realize that we do more than just solutions. This is a list of all of our solutions. We have solutions that address provider data challenges, claims, billing administration challenges, and other sides of our business deal with the coordination of benefits, operating rules, and we also do thought leadership in our explorations portion of our business. So we are best known for ProView, and I like to use these slides to remind you all that we are more than ProView, but proud of it. About CAQH and our members, we are a not-for-profit trade alliance, and we are, what I love about our organization is I say that we are .org with some of the passion and entrepreneurship of the .com. What you're seeing on your screen are a logo screen of our members, and so our work is guided. We were birthed out of the American Health Insurance Plans Association, and we have members that help guide our work, and they help support our work and increase its adoption. Getting into the presentation. So as all of you know that are here on the phone with us today, health plans and provider groups enter into delegated arrangements to improve their credentialing and enrollment processes. And you all have been doing this for quite some time. And to a large extent, it's working. You have smart people, consistent procedures, powerful tools to manage each side of the equation. But the lack of industry-wide standards often results in inefficiency and poor data quality. On the plan side, they are flooded with disparate roster formats at varying intervals. To cut through it, it often includes irrelevant plan data and excessive data. So to cut through it, it requires human time and effort to prepare the data, clean the data before they can ingest it into their systems, and it's usually a human and a manual effort. And this does result in inaccuracies, either through manual processes or through incorrect data being sent. And on the group side, those of you who have multiple delegated arrangements, I'm sure that you have unique roster formats, unique intervals, different field requirements for each delegated arrangement. In addition, you probably have some different formats and schedules you have to maintain for the change reports. Also, inboxes are wonderful business tools. They're not great project managers. So those of you looking for transparency and tracking and status, using an inbox are frustrated. You don't really know when you send it off what happens next, who's got it, and how soon. Bottom line, most plans and groups do not realize the full benefits of why they got into delegation. And they end up addressing these challenges by throwing more time and more people at it. It ends up being an excessive resource-laden approach in order to get this job done. And it does get done, but it is costly and it still results in unsatisfactory data quality, slow updates to systems, which can adversely affect patient access and claims processing. And on the patient access piece, we see this not only in our phone calls from patients or calls to our network centers for plans. We also see this from CMS, right, in their annual audit. So what to do about it? CAQH collaborated with plans and groups to address these challenges and come up with a streamlined solution. This graphic will show you a high-level overview of our process, but we started by talking to our member plans who brought this to our attention years back, and we analyzed well over 50 roster files. We looked for common data elements and disparate data elements and negotiated down to a standardized set, which was the first key and important step, and certainly a difficult one. We then led discovery and design discussions, and we developed an initial solution that was released to over 20 plans and groups last summer for beta testing. And my co-presenters today were two of those beta testers, and we really appreciate that because that testing helped us refine our solution, not refine. And we released CAQH ProView for groups to the general public last October. So we've been at it almost a year now, and our presenters today are very experienced. Okay, CAQH ProView for groups streamlines the maintenance and distribution of delegated roster data for provider groups and health plans. For plans, they can extract a full roster or a change report on demand, and they can do date-limited extracts in a machine-readable, standardized format that has only data relevant to their plan based on the way the roster is built. Also, it's important they have the confidence in the quality of the data, knowing that every roster that they're extracting has already passed 120 data quality checks before they receive a notification. For groups, they have the benefit of maintaining one standard roster file, checking it for accuracy, and sharing it on demand. That means fewer calls, fewer emails, and they have the power to authorize which plans have access and know when each plan has access. Here's a high-level overview of the process. This visual assumes that each side of the equation is already registered. Those of you who are not in there, obviously, we'll talk about follow-ups at the end. But once you're registered, on the group side, you will download the standardized roster, enter data from your source system, or extract data from your source system, put it into our standardized roster. This is an important and certainly challenging step. Change is always tough. We will help you with this, and I'll reiterate that later. You'll then upload that roster. During that upload process, there will be an error check. That first one will certainly have a couple of errors, and that error report you could then use to cross-reference, fix those errors, do an upload. Once you pass the error checks, you'll be able to confirm your roster. Once the roster is confirmed, all of your authorized health plans will automatically receive a notification that new data is available. That plan can then go retrieve the extract or a change report, and they can use that data in a machine-readable format to then ingest it into their systems to update directories, claim systems. End results, plans benefit from a standardized roster, which means faster directory updates, better data quality due to the data quality checks, and easy integration with their internal systems. For groups, it means fewer files, fewer deadlines to manage, fewer emails and calls. Groups also appreciate the increased transparency and security. Here are a couple screenshots to give you a sense of what each side of the equation can see. On the left side is showing the various relationships that a plan, this is the plan view, by the way. So the left side will show the current subscriptions. In terms of the relationship on each side, just for glossary terms, a group authorizes a plan subscribes to a group. So on the left side, we're seeing the subscriptions to the various groups. The plan will be able to see the current and archived group rosters. And from these various cards and the format, they'll be able to then extract data. On the right side of the screen, you're going to actually see the roster extract functionality that the plan will see. And you'll see that they can put in date limitations. For those of you out there who use ProView, obviously you'll notice in our design, a more modern interface and a more minimalist interface as well.
Mike, one question that's come through. Can you give some examples of the type of quality checks that you are mentioning? How does this get accepted as a good roster?
Sure. Number one, most common data quality check that we're doing is data validation. So it starts with data type. And the most obvious thing would be putting a text item in a numeric field or a numeric field in a text field. So that's the most basic and most common scenario. The next would be the length of data and detail. So when it comes to standardized identification numbers, those things matter. There are date ranges and date fields that will trigger off an error so that we can catch manual entry problems or source file problems coming to us. And the next piece of it is in the works. I just want the attendees to know that we do have data scientists on board who are testing hypotheses that we will then roll out in future releases to do additional data science-based quality checks. So this is a snapshot of what providers will see on the provider side. This is the group's homepage, and there are two basic functionalities that have detail within them. You'll see it on the top navigation. There's roster functionality, capabilities, and then there's authorizations, which is where they work with plans. What you're seeing on the screen now is the roster screen. On the screen, you'll be able to download a blank standardized roster. You'll be able to upload your roster, check it for errors. Once that's done, you'll be able to authorize which plans receive it. And on that authorization tab, you'll be able to see the various relationships and activity from each of those plans. If there are errors, this is where that error report will flag, and you'll be able to download that. The single roster format allows integration with the group's provider management system. We have news on that coming later in the presentation, but realize that we know that part of interoperability and portability is having systems talk to each other, and we're working hard on that. And I'll get to that shortly. Lastly, you can see the review, and review the delivery dates when each plan accesses the roster file. Good, we're queued. At CAQH, we understand that change in standardization is hard. That's why we have a team of people and a variety of resources available to help you start well and also support you along the way. My coworker, Taj Longmire, and I can help health plans educate and recruit their delegated groups on the benefits of switching to this new standard format. And our operations team will help your groups build their initial roster and support you ongoing into the future. We also have resources available to both groups and plans, and we'll be adding more in the future to help you. You should now be seeing a map, and this map basically illustrates, I want you folks to know that you're not alone, and in the past year we have had quite a bit of interest, and this simply illustrates that on this heat map, demonstrating the provider interest in ProView for groups by state. Also know that a recording of this webinar is going to be available at the end, and we'll reiterate this at the end as well. Lastly, in terms of adoption, more importantly than interest is adoption. A key piece to this solution is, I would say the number one question we get when we're speaking to a plan is, how many groups and which groups are in? And when we're speaking to groups, how many plans and which plans are in? So the more adoption, the more benefit it is for everybody. Interest is one thing. This list will show adoption. We have a good amount of adoption across the country. We're adding new groups and plans regularly. We will share the slides with you as well as access to the recording afterwards so that you can review this. Last piece, CAQH has established partnerships with provider data management systems, and there are more to come. We're actively communicating with a variety of folks. MD Staff is our first, and that is already released and launched with their 9.1 version of MD Staff. And we have a webinar coming up on that shortly. So we're collaborating with others. We're also happy to let you know that some of our more eager and technically savvy users have been able to get their source systems to map to our roster successfully, including Cactus and other systems. So the opportunity is there, and we hope to have more in the near future. This ends my overview of how CAQH ProView for Group improves the delegated roster process for plans and groups. Now you're going to hear from Blue Cross Blue Shield of Tennessee and Ballad Health and how they've improved their delegated roster process with CAQH ProView for Groups, starting with Valley Osborne, Credentialing Manager for Blue Cross Blue Shield of Tennessee. Valley?
Thank you, Mike. This is Valley Osborne, and I have been in the credentialing world for about 25 years, and so this was kind of a godsend for us when it came up and we were requested to be a beta tester. But Blue Cross is the largest insurer in Tennessee. We have about 65% of the market share in the state of Tennessee, but we only delegate to 2 groups currently. So the initial process, how we have with the group that we have before we got into a delegate relationship with Ballad, and we were using literally Excel spreadsheets that would go from the group to the payer, to Blue Cross of Tennessee, and it would essentially have 3 tabs: a new tab, a delete tab, and then the full roster. Well, what was happening then, we would get that, say, on the 20th of the month. Then my credentialing staff would sit and manually key from that roster into our CAQH system and put all the information in there. Well, the problem that we ran into was we have a state of Tennessee contract with our Medicaid line of business, and they have a 30-day turnaround time that we have to have. This 30-day turnaround time that we have got to meet. And so you can imagine, by getting in a roster, especially right after graduations or whatever, of that being a whole lot of information to key in by one person. So it was very time consuming. We didn't meet the turnaround times. It was hard to keep on track. And we really didn't have any quality checks. We were just taking their word, putting in, garbage in, garbage out. So we were really just taking whatever they told us. So eventually, back last year, CAQH has come up with a solution, and they asked us if we wanted to use the solution about the same time that Ballad, we were talking with Ballad and partnering with them, and they have requested delegation. So we thought, wow, this would be a perfect opportunity. We've been requested to be a partner and a beta tester. So what was so advantageous for us was the help of the CAQH team to get that up and running, because they not only reached out to us, but they also reached out to Ballad and helped them. And I'll let Lorraine speak about her experience, but my experience has been very, very pleasurable. All of the folks have been very nice and helpful. They help you set that roster up, help you make sure that you understand how to pull that information down and what you need to do to pull that information down. And so it's really just been a great thing for us. So some of the things that we've really saved on is it's a lot easier to meet those turnaround times. Now we have all of the information. It goes, straight in. There is no possibility of miskeying a number, or, so our quality has obviously gone up. This one full-time employee that I had doing this, I have them on other things, which is very nice. We could all use an extra hand every now and then. And then any kind of issues that we have at all, it's not in between the delegated group and us, it's between us and CAQH, which is nice. So that doesn't put those relationships in harm just over a data feed. Lorraine and I very rarely have to speak, but if we do, it's about something totally different. It is not about, we didn't get your file today, we need it by next week, or anything like that. So it's really nice. My recommendations would be, if you wanted to use this, which I would recommend that you use this process, is just build a really good rapport with the CAQH team, because they will help you. And, you're going to find that you've got so much more time to utilize your people better. So we really like the process. We will be, our other delegates hopefully will be joining this process, and in the future we will mandate that anyone else that wants to be a delegate will need to use this process, because it's so much easier for us. So having said all that, I'm going to turn it over to Ballad and Lorraine and Susan. Thank you.
Thank you, Valley. This is Lorraine Dover, and I'm the Director for Contracting and Provider Support Services for Ballad Health. I'm over the Credentialing Enrollment Department and the Provider Relations Department for our entity of the network. With Ballad Health, it serves 29 counties, and those consist of Northeast Tennessee, Southwest Virginia, North Carolina, and Kentucky. We have 21 hospitals. We have over 800 physicians in our in this plan right now, or working with this CAQH. We have 30 delegated plans total that we're trying to get all of those plans joining this particular process that we have. And we recently went through a merger of 2 different health systems in the last year. So this has really helped us to start streamlining our processes, where we're trying to combine a lot of tax IDs, a lot of different entities. So it's really helped to enhance what we were already doing. With the previous roster process that we had, the initial process, we're using crystal reports, building different reports for each health plan, which of course takes a lot of time up front, and then extracting that data from our provider data management system. In emailing those rosters to each plan according to whatever scheduling requirement that they would ask, whether it be monthly, weekly, bi-weekly, and whatever they required. That data would also be updated through crystal reports whenever a plan requested that they needed changes or their data elements changed. And so it was a lot of moving parts that were consistent beyond that initial process, but a lot of work up front as well. And those challenges with that are having a lot of work, which is about a half a day work is what we boiled that down to maintain all of those rosters. It was very time consuming for that. We had multiple timelines and multiple formats, not including all the numerous email addresses that we had to keep track of, make sure that those were read, make sure they were constantly going to the correct email boxes, and that those people picked up that email when we got it to them. So a lot of manual work in a different way than what Valley spoke about earlier. Why Ballad chose to use CAQH ProView for groups, we were also asked through Blue Cross Blue Shield of Tennessee and CAQH to be one of the beta testers for it. And when we heard what CAQH was doing, Blue Cross Blue Shield and I, Valley and I have had a really good relationship since we started working together, and we really felt like this would enhance the already great relationship that we had, and would be beneficial on both sides for streamlining our processes. So we use now one standard report for all payers. That was a wonderful advantage to us. Instead of having to customize every time a payer wanted something different, we can now standardize that because they're actually getting more information than what they had asked for originally. So there's not that chance of sending a report through and then, oh wait, there's a column that we need more, we need additional information. Now they're getting all of it, and they can choose what information it is that they want to keep and put into their system. We date stamped the date stamping for those roster downloads. That's a very attractive feature because we don't have to wonder whether they opened that email, if they got the email, went to the right email box. All of the HIPAA and secure and confidential information that goes through with these rosters, as you can imagine, it's very cumbersome to make sure that those go to the correct places and that they get there. With those standard reports, the requirements don't change, so we're not constantly updating spreadsheets or changing them. And then they, as Valley talked about, the built-in quality checks. And for us on the quality checks, where we see an advantage to that is it asks for complete information. We're not allowed to send rosters if someone accidentally forgets to put in a board cert or some type of information. We can't send that roster. So it's a quality check for us, an audit for our system to make sure that it's complete, and also to standardize how the information goes into the system, and so that everyone gets the same information the same way. So it makes the work a lot easier on our part and our employees, so team members that are entering the data and know that we're all putting it in the same way. And I'm going to hand it over to Susan Whitfield, who's going to talk a little bit about the streamline process.
Yes. So I'm Susan Whitfield. I'm the database analyst here at Ballad Health. And I'm the one who helped get this started in the beta group. Basically, to start it out, CAQH gave us their resource list. And so I took that resource list and I standardized our data so that whatever we extracted from our current database would be in the format that CAQH would accept in their file. So after doing that, I built the new crystal reports to pull out the 3 different tabs that they were looking for. I pull that data weekly for 8 different plans and upload it to the CAQH portal. When it uploads to the CAQH portal, there's a great feature that standardizes all of the addresses. So the plans get standardized addresses, and you don't get suite spelled out one way and abbreviated on the next address. So it's really nice that it standardizes it to the USPS addresses. It also gives you, like was already mentioned, an error report. So when submitted, it tells you if a license is expired and you need to get that fixed before you can resubmit the file. So it doesn't allow you to send over expired information. Each week I take the prior file that was sent, I take the new file that I'm preparing, I bump it up against each other to try to make sure it's as accurate as possible, and then I rely on the error report to let me know if I'm missing anything. So it's very helpful. And like I said, we submit for 8 plans right now, and adding more plans would not be any problem at all. You just add the number that the plan corresponds to, and it goes out to the report, and they pick it up. And it's nice to know that it's been delivered to a secure place and that it's been picked up. You can check to see, and you get an email letting you know that the plan has picked up that file. So again, there's no email addresses, no contact people that you have to keep up with. You know it's in a secure place, and you know it's been picked up by the plan. I highly recommend it. There was a little bit of work in the beginning, but I understand CAQH will help anybody get their file set up and ready to pull rosters out. So it's a very easy, streamlined process. It makes everything very standardized for everyone across the board. And as a data analyst and someone who has to create the reports and pull the reports, I recommend it completely.
So for us, you can see the benefits on that last slide that's showing to Ballad Health or everything pretty much that Susan had already addressed. And as Valerie said before, there's fewer questions. She and I, if we do communicate, we're talking about other items that we need to take care of and things that are not having to day-to-day talk about rosters and lost information or information not sent, those sort of items. So it really streamlines the work that you need to be working on, and you know that those reports are going over in a consistent manner, same way to the same box every time, and you know they're being picked up because you can look and see at any point. You know, you're not bound to timelines, to formats. As far as for each plan, you've got everything there. So for us, we've really enjoyed it, and like Susan said, we would highly recommend it to anyone, and really trying to get all of our plans on that same process. So,
and CAQH has been very helpful with any questions that we've had. To help us get through any issues that we might have run into. They've been very helpful with that as well.
With that, we will send it back to you.
All right, thanks so much, everyone. So I first want to just apologize to everyone. I know we've had some technical issues on this webinar, and I want to let you all know that we will be sending a recording of the presentation out to everybody. So if there's anything that you can catch, you'll be able to listen in again. So at this point, I'm happy to take some questions, and we've actually had some that have come through already. So the first, I think, would go to Mike. Is this delegated roster process being used for dental or just medical?
For right now, it is just being used for medical plans, and we will be talking about dental, I think, in the next year, but for now it's reserved to medical.
There's another question about the cost to the health plan. So I want to mention this is free to groups. There's no cost to participate for groups. There is a nominal fee for plans, and for more details on the cost for your plan, if you could contact sales@caqh.org, they can give you more of the details about the cost. So another question, is this data included in the current ProView service, or is this a separate set of APIs/extracts from ProView? That question is for Mike.
Yes, this is a separate data set. So this is for delegated roster data, which was previously a gap or a partial fill, if you will, from our traditional ProView platform, which is self-attested, non-delegated provider data. So this would be separate and should be in addition, right? It should be helping you fill in the spaces for your various systems and directories and use cases. It will not replace ProView, certainly not in the immediate future, because the other half of the question was, do we need both services to get a complete picture? For now, yes. We are testing the data against each other, and when we are satisfied with the quality of the data and the adoption is higher, I know that our solutions team is hoping to converge at some point in the future. The quick answer, 2 different data sets for now.
Next question is for Valley. So you mentioned that you were able to pull the data out of CAQH. Can you just give a little bit more detail about how you set that up and how that works?
Well, the information, our IS department did have to work a little bit with CAQH so that it was seamless. So once we pulled down the file, that it would go straight into our CAQH system. So that was an IS task here on Blue Cross's side to do that. But now that it's been done and all of those elements are done, it's a one-time thing. So you would just be able to, the next delegate that we add on, then we're not going to have to do that again with a different type of roster. That was what we were facing, was all of these independent people that we were thinking about delegating to. If they all have a different spreadsheet, then each one of them would have to be mapped to our system. So that's why we like the standardization of the CAQH, because now we know that every one of them is going to look the same, no matter if it comes from Group A or Group B. And then we can just download that information straight into our CAQH system.
Great, thank you. Another question, maybe for Mike and also perhaps the folks at Ballad. How do you report revisions, and how are revision effective dates reported?
So I'll get this started. CAQH ProView for groups does track all activities and date and time stamps it, and it will auto-calculate change reports based on changes. So that very first roster is important. That becomes baseline. Any change on the second, third, and subsequent rosters becomes a stamped change, and through that process, those revisions are reflected in a change report. Groups can extract it based on roster version or date ranges to get to those revisions. Ballad, so Lorraine and Susan, do you have any other color to add to that response? The initial question is, how do you report revisions, and how are they reported? How are the effective dates reported?
I don't have anything to add. I mean, the change report is what does pull the changes out as far as how we report it. I mean, if there's a license update or a name change, it pulls out in that change report.
Just what you said would be our same answer for that.
The only thing I have to manually go in and do is record the terminations, whether it be a location termination or a provider termination, manually on my end. To see who falls out, I go in and add them back in, put the term date, and then it sends over, and it shows up on the change report.
Good point. Good catch. So for the person who asked that question, yes, there is a manual or a data merge entry of term dates, whether you're terming a location or a provider. Those are entries. Additions are auto-tracked.
Another question for Ballad. You had mentioned that it was taking half a day to manage the rosters. Can you clarify, was that half a day for one person? Was that half a day every month? Can you just give a little bit more color to what you meant by that?
So we prefer to send our rosters on a weekly basis due to the number of changes that take place in our organization in a week span. And we have a team member here who takes the files that were created through Crystal reports that are extracted out of our database on a weekly basis. She compiles those reports by pulling them out of Crystal, and then she would send them out after kind of glancing at each one to scrub them, because it is raw data. She would send them out, and they would have to go out individually to individual email addresses for each payer. And like we said earlier, we have 30 delegated payers that we send rosters to. So the process really did take about a half a day, and now it's done in a couple of hours at most, and it goes out to multiple payers at one time.
And there again, I think one of the big attractive traits for us also, scrubbing it, a person sitting there scrubbing that information, looking for information. You have human error with every everything and everybody. So that quality check is a very attractive feature for us as well, because it's the second audit before it goes out into the portal.
Okay, great, thank you. Is there a way to communicate back to the group within CAQH ProView that their updates have been completed and the effective dates associated with those updates? Mike, do you want to take that one?
Sure, I'll take the first half, and I'd love my co-presenters to continue on with this to find out what happened. So the first half of the equation is yes. You basically, the way we have this set now with what I call transparency and activity tracking, you'll be able to know when the group will be able to know when the roster has been accessed and by whom. And on the plan side, you'll know and receive notification when new data is available. That said, we do not yet have a communications module in there where you know that the provider system's been updated on the plan side or the claims system. So I'd like to kick it to you guys. Sorry to put you on the spot if it's not a clean answer. How have you handled that secondary piece of what I call transparency or tracking?
Okay, this is Valley. So I'll take this question, because once the information comes to us, then you're really just bypassing the credentialing shop. So you still have to be enrolled in our claims adjudication system. So those go through the standard processes. So a letter goes out to the provider telling them the networks that they're involved in and that they've been approved. What they will not see is like something from my credentialing shop that says, hey, you've been credentialed, blah, blah, blah. That's happening at Ballad. So it's not happening here. And we're taking their information. So the continuation of the process still remains today. If there were a possibility of us being able to put information back on that would probably be on the file back to Ballad, that would probably be helpful. But currently we do not do that. It's just a standard process from there forward. You're just really bypassing all of the credentialing.
Any other comments, Ballad?
No, I mean, I agree with Valley on how we're communicating that information right now. And Valley can tell you too, we haven't had issues on any of that where we work so closely together with the delegation and our processes and our audits. So we haven't had issues with any of our plans that we're working with on that. It really eliminates a lot of the questions. To your point, Mike, and the emails and the communication when you're able to pick that information up. One of the things I would like to say to that, being able to enter or being able to submit at any point in time, it's helped us from the standpoint of if you had a group that you needed to term out quickly for some reason, you wouldn't have to wait till the next week to get that roster to the plan. You could send that as soon as it happens and get that in process and get that in motion a lot quicker. So I just want to point out it helps from that perspective. If we ever have someone we need to send that through right away and get it out, we can do that as well, and it sends out those notifications to the payer for that too.
Good response. Thanks for mentioning that. This is a question that we often get, so I'll address before it's asked, which is, in general, we recommend that groups, and we've found that most arrangements require an update every 30 days. If there are no changes, you simply just upload the last roster, and that is your way of basically serving as a confirmation to your plans that there are no changes. It's like a reattest, but in this case, it's a group admin confirming a roster for enrollment purposes. The last piece of that question, how do you report revisions? How are the dates reported? Is there a communication module? I just need to close that out and say, yes, on our development backlog, the team is looking at ways to add additional brief communication that will be sort of different, unique, concise, and value add from an inbox to say, yep, got it. Nope, need this. Here's a status change. So we're looking into that, testing it. It will not be on our next release, but it's on the list.
This is another question for Ballad. What improvement in turnaround time have you experienced in obtaining effective dates for your delegated providers using this new process?
I would say we're pretty streamlined already with that because we're delegated with Blue Cross Blue Shield, but we do see that it gets the information gets to the plan quicker, and then the plan can load that information quicker as well. So with Blue Cross, it's pretty streamlined. With some of our other plans, getting that to them has helped them to get the information into their system quicker. So, and normally we see about at least a minimum of 30 days for a load to take place. But we've seen some of them say that, due to the processes and improvements, there's sometimes that we can see 2 weeks turnaround time and getting that stuff loaded. So I think from a plan perspective, and Valley, you may be able to speak to that a little bit, but we're pretty streamlined with them right now.
I would say that we can get everything done, pretty much within 10 to 15 business days. Wouldn't you agree?
Yeah, I would agree with that. And so I think even for those plans that you may not be, that may have larger turnaround times, yes, I think it condenses that time frame.
So another question is, and I think this is for Mike, is this roster used for behavioral health groups also?
It can be. The key thing here, I've spoken with a behavioral group before. The key thing here is being in a delegated arrangement. This is not a credentialing solution for non-delegated arrangements. It's a subset of a full credentialing data set for delegation. So, yes, if you have delegated arrangements with plans and a standard process you're currently following, you can transition to this new process with your plans, and we can work with you to attract those plans and educate them if they're not currently participating.
Okay, thank you. I think along those same lines, there's a question from someone who is a credentialing coordinator at their facility. Will CAQH allow me to manage all our providers in our group, for example, update their information, licensures, reattestations, et cetera?
Yes, I'll rephrase it. If it was up to CAQH, we would say absolutely you have our permission. However, to stay compliant with credentialing guidelines from NCQA, we have a practice manager module currently that allows you to do the demographic and basic information updates in standard ProView. However, the final attestation needs to be done by the provider. That's individually, but the practice manager module allows you to do that in more of a batch fashion. Second piece of it, groups, yes, it allows an administrative professional to do all of the work for all of their providers for enrollment purposes under delegated arrangements. The last piece is, no, I think the nature of your question is, can I do traditional non-del group batch processing? We're not there yet. We're working hard to bring something to market soon, and hope to have something more for you in the near future, because we realize that that's a need. Practice manager module is your solution for non-del. This is your solution for delegated.
Okay, thank you, Mike. Another question for you. Do you need current ProView to use this, or can you get just ProView for groups as a standalone?
You can do this as a standalone, and I'll just leave it short and succinct there. Yes.
Great. And if you'd like more information on how to do that, once again, you can contact sales at CAQH, and they can give you some information on how you can join, even if you don't have current ProView. There's another question. One of our viewers is saying, I believe it was assumed that the roster would have 2 tabs, additions and terms. Will it also reflect updates such as service location updates, licensure updates, et cetera?
Yes. So the roster, and I'll sort of preempt another question about a full-on demo. And I would say following up with us with the contact information afterwards to do that is the best way to go. We also host weekly demos if you want to sort of dig in on the actual roster format. We can do that one-on-one, or we can do it through our Wednesday afternoon demos. So that roster has 3 tabs: a provider tab, a location tab, and then the magic provider location tab where we bring the 2 together. Using field level detail, we can then line those up to the various payers. Every tab and every row has the ability to term, and obviously the addition of rows and add. So this is how we track along with the adds and the terms. Yes, service location updates can be tracked. Yes, licensure updates can be tracked. And we do have effective date fields in there. Some details are required, some are optional. Last thing that we didn't cover is we realize standardization is hard. There are always exceptions, and to balance those 2, we do have a couple of plan-specific fields so that we can address unique use cases while keeping to our mission of standardization.
Okay, thank you. Can you also talk about what kinds of data are included in the roster file?
Sure. The short answer is think of it as enrollment data, not necessarily the full credentialing data set. And I would say the difference is of what you would see in a full-on traditional ProView versus ProView for groups. We would not have attachments of documents and documentation. You will have details about each provider, their licensure, their certifications, their specialties, their demographics. On the locations tab, we'll get into obvious provider directory details, as well as the detail of which plans are accepted on which days and which times. That's hard work on the first one, and it is highly valuable moving forward to maintain. And it's one of those heavy lifts that will help you with in the beginning that pays dividends in the end for getting that level of detail, which helps your patients. Provider location gets into the participation and marries the two. There's not as much detail there. I hope that gets to it. Please follow up by email or direct if I missed some key portion for you there.
And there's a question, when you say update licensures, one of the viewers is asking, many of our providers hold more than one type of licensure, so they want to add those. So when you say update.
Good point. So I can see the contact detail of the person who's asked this question, and I'd like to go do some homework before I to do a full-on answer. And really the piece of it I'm uncomfortable with is the number. I don't know the limitation or quantity of licenses that we track. So I'll have to get back, and I can do that to the group on our email response as well.
One last question. How often do provider groups need to upload their rosters?
I'd like to hand that off to you, to my co-presenters, and let you guys start that one off. How do you guys handle, how would you answer that question? Starting with Valley and then Lorraine and Susan.
I mean, we really, this is Valley. We at Blue Cross probably just need it once a month, but Lorraine, I think they're loading it on a weekly basis.
We are.
Yeah, we have, the way our current system is, we utilize Vistar Technologies. The way our current system runs, it's easier for us on a weekly basis to load that, because we, as Susan said earlier, we can have so many changes, especially right now as we're going through the changes as an organization in a week, much less, on a monthly basis. So.
And we also, and I think it's okay for me to say this, but we have weekly credentialing files that are approved, and therefore we have a group of providers that are approved every single week, and the sooner we can submit them to plans, the sooner they can become part of our network, and participate in the plan.
Excellent. Thanks for that. I think that real-world example is better than my canned format. The one thing I would like to add is that if it's not already there in our next release, we will have an outbound notification system going every 30 days. So if a group has not uploaded a roster within 30 days, we'll send a reminder, because we find that tends to be the standard. It really comes down to your individual agreement, but 30 tends to be standard. Our users, just like Ballad Health, often just keep up with it as it comes in, and we're finding that folks upload more frequently than monthly.
All right, great. Well, thank you so much, everyone, for joining us today and for asking so many questions. A reminder once again that we will be sending a recording of this webinar out to everybody who attended, and also those who are unable to attend. If you have any further questions, you can follow up with Mike. His email address is up there. It's mwoods@caqh.org. And if you have more specific questions, you can also email sales@caqh.org or visit our website at CAQHProViewforgroups.org to get more information about the solution. That is going to conclude our webinar. I want to thank everybody very much for joining, and we hope you have a great rest of your day. Thank you.